Hello and welcome to Season 2, Episode 15 of the Physician Assistant Exam Review Podcast. This week, we're going to continue with the cardiovascular system, and we're going to be covering congenital heart disorders. My name is Brian Wallace. I'm your host and creator here at Physician Assistant Exam Review. I am happy to be back here once again, sharing with you some information as far as study material and how to best prepare for your exams, how to get the best out of your study time, and just how to do the best you can, getting all this stuff put together and organized and ready to go. This week, we're going to continue with the cardiovascular system. I know last week we covered hypertension, so it would have made sense for me to cover hypertensive drugs this week, but honestly, I just couldn't get it all together. It's been a busy week between the elections, the World Series before that, and just my kids' soccer practice and baseball practice and everything else we've got going on here at our house this time of year. It has become difficult to get everything put together the way I'd want to. So I am most likely going to be covering hypertensive medications next week, possibly the following show. I'm not sure yet. But this week we're going to be covering congenital cardiovascular issues, which I'll get to in just a moment. I want to start off thanking some people, and just a general thank you to those of you who have been leaving reviews in iTunes and on the Your Story page. You guys have really had some nice things to say, really some encouraging things to your fellow test takers, and I really appreciate all that, taking the time to put that out there so that other people can see the successes that you're having. It really means a lot. I'm going to go ahead and read something that Leslie wrote on the Your Story page. She has some nice things to say about me, but that's not while I'm saying it. I want to present this to you so you can see that spending time here, spending time with my material, spending time with this stuff, and really putting the effort into it makes a big difference. So let me just go ahead and read what Leslie wrote. Brian, your podcast and book and study guide saved my life and career. I took my PANRE back in July after taking a review course, doing multiple questions, and failed by 16 points. I was devastated. I had never failed anything in my life. It brought me down where I didn't even know how to restart. I purchased multiple books and got so overwhelmed by the content. I came across your podcast, and which were so easy to understand. I made a complete study guide from your lectures and went through each of them. I purchased your book and reviewed it for the last week. Lastly, I did some Lang questions to review the content in your lectures. I found out today that I passed. I found out today that I passed my PANRE on the second attempt. I owe it all to you. Your book is truly a game changer. Thank you again. And first of all, I just want to say to Leslie, you don't owe it all to me. You did all this work. You put in a ton of effort and time and rebuilt your study habits and made this all very possible. But what I want all of you to understand, what I want you to understand from this is that Leslie had failed her test, right? And then she went through all the material here, used a couple of other books, spent some time with the podcast, and really put in her time and effort, and then rebuilt and passed her test. So I want to just express to you that you're in the right place. The material works. The stuff I put forward, I sometimes get questions about the level that I presented at, because I don't present at a super hard, super high level. I present a lot of the easier stuff, to get this stuff right level. And the reason I do that is because I think it's what you need to know. I think it presents you with the best source of time, the best way to spend your time, the best source of information. We could spend a lot of time in the weeds, and if you want to talk about how to actually practice medicine, that's a whole different discussion, but that's not what we're doing here. We're simply building you up to pass these exams. I've gotten multiple emails from people about how helpful it's been for their end of rotation exams, all kinds of things like that. Another one I want to point out to you, Rob went ahead and wrote in, I took my test back on November 16th, and I got my results today that I've passed. But like everybody else, I thought I'd failed. My take on that now is that we're used to getting 90% correct or better on our exams. We're PAs. We tend to be pretty smart, but that's not going to happen on the PANRE, or I'm going to throw in there on the PANCE. The breakdown from my perspective, he goes on to write, half the questions I knew the answer to immediately. The rest I could narrow down to 2 potential answers. For about 20 questions, I didn't have a clue. Now that's a lot of uncertainty. So he points out that the breakdown for the questions is similar to what I've always pointed out. If you know the basics and you know your key terms, you can get about half of it should just jump into your head as you go. Yes, then there's going to be another probably quarter that you're going to struggle with and narrow down to a choice between 1 or 2. And then there's going to be another quarter that you're going to have no clue what's going on. And I'm okay with that. I think that's a reasonable breakdown. And that's going to get you to pass your test. So if you know all the easy stuff really, really well, you should do fine on your PANCE. And if you're calm and collected when you take it, you should do fine on your PANRE. It shouldn't be a big deal. I think people get too stuck down in the weeds, get too confused, get too overwhelmed with all the different study material out there. And I just want to point out with these two, the last two comments on the Your Story page on the website, physicianassistantexamreview.com, that you're all capable of doing this, that you're absolutely capable of doing this, whether it's the end of rotation exams, whether it's your PANCE, whether it's your PAN rate, not to get yourself too worked up, not to worry about if you've been, out of practice or in dermatology or whatever specialty you think you've been in. And this is just about passing the test. Learn your key terms, learn the material you need to learn, put together a good study plan, and move forward. That's basically how easy it is. It takes time, it takes energy, it takes effort. I don't mean to belittle it, but it's also something that is very achievable. And if we stop spending so much time worrying about it and just get to work. So I wanted to open with that this week. I also wanted to mention that I decided to go ahead and do a Black Friday package of all the material on the website. So what I mean by that is I usually don't do discounts. I usually don't do a whole lot of coupons and things for the material on the website. I think it's really good. 99% of my material is free, and the little bit that I charge for helps to run the back end of everything and pay for all the stuff I need to do to produce the show. So I usually don't do any kind of discounts except for the bulk order discounts I do to different groups of 10 or more for schools. That's worked out really well, but in general, I don't like to do them. But I've had an inordinate amount of people asking me for discounts and asking me for things. So I decided Black Friday was coming up. I would use this as an opportunity to help those people out. And so I thought I'd present it to all of you as an opportunity to get the material that maybe you've been holding off on, that you thought was maybe beyond your price point. So what I did is I went ahead and put together a package of just about all of the materials I have that I've put together over the years, the things I found that would be most useful for you. So that package is going to include the physical copy of the final step, the digital copy, the audio copy of the final step. It's also going to include, I had put together at one point, complete PDF of all of the notes from the website. So the thing's huge. It's like 500 pages long. That will be available in that package. I wrote a short book on test anxiety and how to overcome it, and I've given presentations on that. So I'm going to include one of the presentations, almost an hour-long presentation I gave on overcoming test anxiety, as well as the short book I wrote on it. And then I'm also going to include what's been one of my favorites is the Maximize Your Time and Efficiency course. I haven't put this out there in a long time, but I really like it. And what that course does, it's a video course, but it's short. I think there's 9 or 8 modules in it. Each of them is about between 5 and 10 minutes long. And they go through a very specific thing you can do to improve your study habits, improve your study skills, and get a lot more out of your time and what you should be focusing on. Some of the things we've been talking about on the show, but it goes into a lot more detail, a lot more specifics about how to set up your time, things you should be doing, things you should be focusing on. I've had a couple people reach out to me recently asking questions about that, especially first-year students or second-year students. I think it'd be a great resource for them. I wish I had something like that when I started out, because it would have been a tremendous value. It would have boosted my scores through the roof just to have had those study skills in place. I really didn't have good study skills until probably my second or third year in PA school. And this course quickly outlines great things you can do to improve your time and efficiency when you're studying. So all of that's going to be included in that package. You're going to get the book shipped to you 100% free, included with that package. So what I did was I went ahead and on Black Friday, I'm going to have that package available for 75% off what it would cost you to buy it individually. So for all of that, you can get that entire package for the same thing it would cost just to order the final step as it currently stands. So that would be on Black Friday on November 25th. If you're interested in that and you're worried you're going to forget, if you head over to www.physicianassistantexamreview.com/Black Friday, all one word, there's a place there where you can sign up. You can look quickly at what the package has to offer, what the prices are there, and then you can put in your email address, and then I'll put you onto a very short email list that I'm just going to use to let you know when that opens on Black Friday. So basically at midnight on Thanksgiving, I'll open that up, and that'll be available for the one day. Then what I thought I would do is to make it even more fun, interesting, so I don't get people who complain, oh, you only have this available one day. I was with my family, I forgot. What I'm going to do is make it 75% off on Black Friday. On the Saturday that follows, it'll be 60% off. On Sunday, that package will be 50% off what it would cost you to buy them all individually. And then on Monday, that goes away. So if you want to get an email to remind you about that, just go over to www.physicianassistantexamreview.com /Black Friday, all one word. punch in your email address and I'll be sure to shoot you an email to remind you. Or make sure that you head over to the website. And if you go to physicianassistantexamreview.com/Black Friday on Black Friday, that page will then convert and it'll just be the sales page for the Black Friday package, like I said. So that'll include the complete final step print package, the review binder, the No More Test Anxiety package, and the Maximize Your Time and Efficiency course will all be included in that simply for the price of what the book normally goes for. So definitely go check that out if you've been interested, if you've been waiting. This would be an excellent time to go and take care of that. Like I said, I've had a bunch of people email me about discount coupons and codes and things I might offer and ways I might be able to help them out. So here you go. This is a huge package for 25% of what it would normally cost. That's really the best I can do for now. I think that's a long enough intro. I've been keeping them pretty short for season 2, but this one obviously ran a little longer than normal. So let's go ahead and jump in to congenital cardiovascular issues. All right, as always, we're going to start with our priming questions. A boot-shaped heart on a chest x-ray should make you think of what diagnosis? Boot-shaped heart on a chest x-ray should make you think of what diagnosis? A tetralogy of Fallot. Describe why a congenital heart disorder would cause cyanosis. Why would a congenital heart disorder cause cyanosis? So if you recall, we split them up into 2 groups, the cyanotic and the non-cyanotic heart disorders. What's the logistics behind one being cyanotic? Well, what happens is you wind up with 2 separate circulatory systems. One side's got the oxygenated blood going out to the body and back to the heart, and the other side's going to the lungs and coming back to the heart. The other side has the deoxygenated blood going out to the body and coming back to the heart, and they don't really mix. So in our cyanotic congenital heart disorders, there's very little mixing of the 2 circulatory systems. You get basically a pulmonary circulatory system and a body circulatory system that don't overlap. So obviously that causes some cyanosis and is a big problem. What class of medication is used to close a patent ductus arteriosus? What class of medication is used to close a patent ductus arteriosus? NSAIDs. Hypertension in the upper extremities with low blood pressure when measured in the legs should make you think of what diagnosis? Hypertension in the upper extremities with low blood pressure when measured in the legs should make you think of what diagnosis? Coarctation of the aorta. All right, so let's jump in. Cyanotic congenital heart disorders. So in most cases, cyanotic disorders have to do with the right to left shunting of blood. Deoxygenated blood returning from the body bypasses the lungs altogether and is recirculated without becoming oxygenated. So that's what we talked about earlier. To make this clear in your head, you've just got to have that picture. The blood does not go between both sides, right? It does not cross over. So tetralogy of Fallot is going to be our first one and one you probably hear the most about. It's made up of 4 separate parts, which is where you get the tetralogy part. Most of you are familiar with that. One of the things I find, though, and I'm going to go through this, is again, memorizing this versus understanding it. To me, understanding this is so much easier than memorizing it. Memorizing it, I forget it constantly. I remember it for the exam, but then I have no idea next time I come back around to it. Let's go through each of these 4 parts, and I think they'll make sense to you. So quick, I'm going to run through just the names. The right ventricular outflow obstruction, right ventricular hypertrophy, ventricular septal defect, and overriding aorta. All right, so a tetralogy of Fallot. The right ventricular outflow obstruction. So what that means is the right ventricle usually pushes out to the lungs, right? So this is pulmonary stenosis, essentially, right? That pulmonary valve is going to be stenotic. There's going to be some reason why the right ventricle is not able to push out to the lungs very well. You get right ventricular hypertrophy. Think about it. You have to push against that obstruction, right? So the right ventricle has to get stronger and stronger and push against a high gradient in order to get the blood out. So you get right ventricular hypertrophy. You also have a ventricular septal defect. So this is where the blood does mix a little bit. There's a defect between in the wall of the ventricles. This allows the blood to mix there a little bit. Then you have an overriding aorta. And what that means is that the aorta attaches to both the right and the left ventricles, which seems a little bit weird, obviously, right? Blood goes out from both the right and the left ventricles into the aorta. So this is where you get that why it's part of the cyanotic group. Now, it's not 2 totally separate blood systems, Well, what's happening is you're getting a mixing of blood that shouldn't be happening, right? Between the ventricular septal defect and the overriding aorta and the ventricular outflow obstruction to the right ventricular outflow obstruction, the blood is not circulating to the lungs as much as it should be. So then you get this cyanotic effect. Why do patients present? Usually in the US at this point, this is going to be something that's going to be picked up on ultrasound early on. But if untreated, you can have TET spells, which is a young kid having extreme hypoxia, cyanosis, syncope, and hypercapnia. You can see clubbing of fingers and easy fatigability, especially when feeding, that kind of thing. Physical exam. I don't want to get too deep into murmurs today. Along with medications, I was hoping to avoid murmurs. They come up a little bit during this section. We'll go back through them in more detail in a different section when I cover them, like I said, in more detail, and we'll come back and review these and make sure that you've got them. So the murmur here is a crescendo, decrescendo, wholly systolic along the left sternal border and radiating to the back. Like I said, at this point, I don't expect you to memorize that, especially if you're driving in your car or jogging. A little tough. Murmur is a crescendo, decrescendo, wholly systolic along the left sternal border and radiating to the back. In the next couple, we will cover murmurs in detail, and at that point, I'll come back through all of these. Don't worry. Labs and studies. You're going to get a chest X-ray. This is just historically significant. You get that classic boot-shaped heart due to the right ventricular hypertrophy. No interstitial lung markings, and the echocardiogram is used for diagnosis. Treatment is going to be surgical correction. This is not something you're going to treat medically or live with for a very long time. Next, we have pulmonary atresia. This atresia is an opening that is either closed or absent. Pulmonary atresia is therefore a closed pulmonary valve. Treatment here is by surgical intervention. The next one is going to be hypoplastic left heart syndrome. Hypoplastic equals very small or underdeveloped. Hypoplastic left heart syndrome equals a small, underdeveloped left ventricle and aorta. So what you get is this little, teeny, almost non-existent left ventricle. Obviously, this causes some very serious problems with getting blood out to the body and will lead to cyanosis. Transposition of the great vessels, a complete transposition of the pulmonary artery and the aorta, and a lot of the other vessels is possible. At birth, prostaglandins are given to keep the ductus arteriosus patent because obviously if we have a complete transposition of the great vessels, the two circulatory systems don't mix at all, right? The blood just simply circulates on either side. So we want to keep the ductus arteriosus patent, and that allows the two circulatory systems to mix. Obviously, surgical intervention is going to be the only long-term treatment available for these people. Remember, when you are before you're born, as a fetus, you have the ductus arteriosus and the foramen ovale, which is open, which allow the mixture of blood between the two sides of the heart and allow the blood to sort of skip the lungs and not have to go there because it's not necessary as long as you've got the umbilical cord. Once the umbilical cord's gone, the patent ductus closes down, and the ductus arteriosus closes down, and the foramen ovale closes up, so the blood doesn't mix through there anymore. But if we're trying to get it to mix, we want to keep that ductus arteriosus open, and we do that by giving prostaglandins. Now, just the opposite we'll get to in a little bit. In order to close the ductus arteriosus, if it remains patent and we don't want it to, we do just the opposite. We give NSAIDs because those will stop the production of prostaglandins. But I'll get to that shortly. Non-cyanotic congenital disorders. First of all, atrial septal defect. This is an opening between the right and left atrium. This most commonly occurs when the foramen ovale does not close or is too large. This can create either a right to left shunt or more commonly, a left to right shunt of blood. So if you think about it, it can really go either way, right? It just depends on pressure. And if you have two sides of the heart and a hole in the middle, blood can swish back and forth. So if the right side contracts, it can push the blood over to the left side. Well, that's certainly possible, but in most cases, it's going to be a left to right shunting of blood because the pressure on the left side of the heart is just significantly higher. On physical exam, you may hear a systolic ejection murmur in the second and third intercostal spaces. There may also be an early to mid systolic rumble. Labs and studies. So an ECG is going to show right ventricular hypertrophy, right bundle, and possibly right bundle branch block. A chest X-ray can show an enlarged right heart, large pulmonary arteries. On echo is going to be how you're going to diagnose this, and a cardiac cath is going to give you much more detailed information about that opening. Treatment is going to be surgical closure if it's big enough to require that. Sometimes you don't need treatment, depending on if it's just like a little pinhole that gets discovered. but definitive treatment is going to be surgical closure of the defect. Like we talked about before, patent ductus arteriosus, PDA. The ductus arteriosus is a blood vessel which connects the pulmonary artery to the aorta. In utero, this allows most of the blood to bypass the lungs. In utero, that's a good thing. Once the baby's delivered, that's a bad thing. Patent means open or not obstructed, and usually the ductus arteriosus closes at birth. What patients present with, it looks like signs of left ventricular heart failure and pulmonary hypertension. Remember, this is a baby, though, so you shouldn't be seeing those signs in a baby. That should seem very, very strange. On physical exam, the machine-like murmur is sort of your key term here. Machine-like murmur, if you ever see that on a test question, be very thankful and answer patent ductus arteriosus. You may get a thrill or wide pulse pressures. Labs and studies, your ECG is going to be normal, your echo is going to be normal, MRI, CT, or cardiac cath is going to be how you visualize this shunting. Treatment, NSAIDs to help close a small shunt. They inhibit, like we said before, they inhibit prostaglandin production, and prostaglandins keep the shunt open. Typically, this is going to be IV indomethacin in the first 10 to 14 days of life, and then surgical correction may be necessary if it doesn't work. Next, we have coarctation of the aorta. The word coarctation simply means narrowing or constricting. I also saw a couple places where they use the term stenosis or stenotic as a synonym as well. So it's a narrowing of the aorta. Very simple. Coarctation of the aorta just means narrowing of the aorta. Okay, so don't let these terms trip you up or confuse you or let you forget what you're talking about. And narrowing of the aorta. Why patients present, or it's really the physical exam findings you're going to see. Failure to thrive. Again, we're talking about infants here. Chest pain, lightheadedness, shortness of breath, heart failure in an infant, hypertension, and hypertension leading to left heart failure. Physical exam, delayed or weak femoral pulse. Hold on to that one. That's definitely a key term. Something you should know. Harsh systolic murmur heard in the back. Hypertension in the upper extremities with hypotension in the lower extremities. So if you take a femoral pulse, it's pretty weak. If you take femoral blood pressure, it's very low compared to a brachial blood pressure. Definitely an easy way to ask a test question, an easy way to get something right. Labs and studies, ECG, left ventricular hypertrophy. Echo is going to be your diagnostic lab of choice. And your CT, MRI may all be used for more information. Treatment. Patients younger than 50 is going to be open surgical repair. Patients younger than 50 is going to be open surgical repair. Patients older than 50, stenting is going to be the best choice in most cases. So you're going to put a stent in to open that up. So remember, we said it's just a stenotic, a closed down vessel. You can put a stent in and widen it out. All right, so that brings us to the end of congenital heart defects. A little breather after hypertension. And going through those, we will pick up with some more in the next couple of weeks, continue with the cardiovascular system and keep that going. For right now, let's move on to our study tip. And this week, the study tip is a little bit different. And because of some personal experience I had this week, my study tip is going to be more a tip for your rotations. So unfortunately, those of you taking your PANRE, hang on just a second. The tip here is going to be on your rotations. Your main job, your main focus is to be interested. Show that you're interested and that you want to be there. And I'm saying that because this week, not just this week, but every week we get students come through where I work. Mostly, I have nursing students in my room for their day, a couple of days in the OR. Sometimes we get medical students, sometimes we get PA students. But right now, we're going to start getting more PA students soon. But right now, we get a lot of nursing students. And I get a new nursing student in my room every single day. So when they come into the room, I've already said the same things I'm going to say to them, explain the same procedures I've explained hundreds of times. It's almost like Groundhog Day for me with Bill Murray. I have that speech written so clearly in my head, what the things I explain to them, how I go through the anatomy, what I show them, how I want them to see things. If it's a robotic case, when I time it so that they can look through the robot. But honestly, I know for you on your rotation, it's your first day there, you're excited, you think everyone should be excited to meet you and to see you. They've all done it thousands of times. And it's not that they don't want to keep doing it, but it's that they've done it so much that it gets kind of old to them. So what I'm saying is I had a nursing student in the other day who was very pleasant and super interested in what we were doing. So I spent a ton of time with her going through the anatomy, explaining to her exactly what we were doing, and she just enjoyed, or seemed, at least for my benefit, seemed to enjoy every minute of it. And my point is, I have other students who come in and they pull up a stool and they sit down and they don't talk at all. And anything I explain to them, they don't seem that interested. And then they're going to leave and say that the OR wasn't that interesting, that nobody really talked to them. I just want you to show up and be interested, because you're the one who's new and you're the one who's going to get the most out of this. All of the docs, all of the residents, all the other PAs, they're going to want to teach you. Most people like to talk about their job and about what they do. If you show an interest, if you want to be there, if you want to learn, it'll make the experience so much better and so much faster and so much more enjoyable for the both of you, for everybody in the room, if you're interested when you show up. If you ask if you can help, if you ask if there's things you can do, if you see something that you can pick up off the floor and throw in the garbage, those kind of things go such a long way to how much they're going to show you, how much they're going to let you see, how much they're going to talk to you. So take some time and be interested. Even if it's a rotation that you can't stand and don't want to be there, it's going to make the rotation so much more enjoyable, and you're going to get so much more out of it if you show up and participate and do your best, and you smile and you act like you're interested. It'll make a tremendous difference. So anyway, I just want to share that. Like I said, I just had a great nursing student this week, and I just thought, geez, I felt really good going through everything with her, as opposed to some that I've had recently where I didn't even say 3 words to, and I feel bad because that's their experience of what we do in the OR. But like I said, it's probably the 1,000th time I've had to give that that same talk, and sometimes it's easier just to get your work done than it is to have to stop and explain everything. And if you don't feel that interest coming back, then you kind of back off too. So be interested, show up to your rotations, do your best. That's my 2 cents. Post-test questions. Why do NSAIDs help close the patent ductus arteriosus? Why do NSAIDs help close a patent ductus? They block production of prostaglandins. Here's an easy one. A machine-like murmur should make you think of what diagnosis? Machine-like murmur. Patent ductus arteriosus. What is the most common site of an atrial septal defect? What's the most common site of an atrial septal defect? The foramen ovale. What does the term atresia mean? We talked about pulmonary atresia. What does the term atresia mean? Closed down or narrowed. All right, great. So that finishes episode number 15 for season 2. Finishes up the second part of the cardiovascular system. Again, I just want to say thank you to all of you who have been leaving iTunes reviews. Those have really been great, leaving information on the Your Story page. All that stuff really helps the community. People love to read through that and get encouragement, both from the people who failed, the people who failed and then passed, the people who passed. It just means a lot to everybody. I get emails a lot from people saying how thankful they are that they've been read through those sections, and it's really built their confidence and made them feel good. So if you haven't left any reviews in iTunes or anything in the Your Story page, even if you haven't taken your test yet, it might not be a bad idea to go check that out and to leave something in one of those 2 places. The other thing, again, I just want to remind you, the Black Friday deal is going to be available the weekend after Thanksgiving, Friday, Saturday, Sunday. It'll be 75% off on Friday. Saturday will be 60% off, and Sunday will be 50% off, and then it ends. If you want to be notified immediately when that opens through email, go to www.physicianassistantexamreview.com/Black Friday, all one word. If you head there right now, you can go and put your email address in, and then I can shoot you an email when the cart opens and remind you to go ahead and get your copy of everything, that whole package. Like I said, at 25% of what it would cost you to normally get it. It's the best deal that I've put together ever on the website, so definitely go check that out. And if you wait until Black Friday and you haven't sent in your email address and give me the opportunity to remind you, then if you head over to that same web address, www.physicianassistantexamreview.com/Black Friday, that'll bring you right to the page where you can check out that deal and go ahead and grab your discount. And so that should work out really well for everyone. So thanks again. I know I had a couple people taking their exam this week, and good luck to you. Congratulations to the 1 or 2 of you that I heard from this week who passed your exams. I did read your emails. and I am so excited for you. And those of you, again, taking it this week, good luck. And I won't talk to you before Thanksgiving, so have a happy Thanksgiving, everybody. Happy, safe travels. Get to where you're going safely. And I look forward to hearing from you soon. Take care.